Dental splinting, conservative approach to strengthen loosened tooth. Teeth that have become loose because of lost gum tissue can benefit from a new technique called dental splinting, which attaches weak teeth together, turning them into a single unit that is stable and stronger than the single teeth by themselves. The procedure is most commonly performed on the front tooth. The procedure is as simple as using composite material to attach or splint the loose tooth to the adjoining stable tooth. Tooth splinting is a common procedure that has gained popularity due to its effectiveness. In dental splinting, teeth are joined together using a thin fiber reinforced wire, thereby increasing their stability. This is a factor which allows them to function normally. This procedure is beneficial because it allows you to save your original tooth. Additionally, splitting also reduces the pain that a very mobile tooth can cause. Mobile lower anterior teeth are a common complaint of dental patients with rarely advanced periodontal disease. Treatment of these mobile teeth is often not very successful. The mobility is caused by loss of supporting bone around the roots of the tooth. Even comprehensive periodontal treatment cannot replace the missing bone, and prognosis of these teeth is poor. The most logical way to treat mobility once the active periodontal disease is under control would be to splint these mobile teeth. Various methods of splinting are employed by our cosmetic dentist. The most frequently used technique is to use orthodontic stainless steel wire and fiber wires. Method has success, but the metal wire is quite rigid, and this type of splints tends to come loose and fail in time. Another disadvantage of the technique is there is no good bonding between the metal wire and compositing filling material. There can also be aesthetic compromises with the technique. Nowadays, what we commonly use is a fiber splint. Fiber splint is a transparent or a tooth-colored splint that is bonded from behind of your tooth, giving them additional support. Fiber splints are aesthetically very sound, so patient can wear them for a longer period of time. They get bonded with the tooth naturally with the resin bond and composite material. Because of the aesthetics and comfort to wear, fiber bands can be worn for longer period of time by the